Hello, everyone, and welcome to SoftFil Academy's webinar. We are very, very glad to welcome all of you tonight. And of course, a very warm welcome to Dr. Nina Bal, who is with us. It's the first webinar with SoftFil Academy. So very welcome, Dr. Bal.
Thank you so much for having me.
So I will just give you a little bit of details on the webinar. This webinar will last approximately an hour. You can ask all of your questions in the Q&A or in the chats. Don't hesitate to ask questions all along the webinar, and we will ask all of the questions at the end of the webinar. This webinar also is being recorded, so if you have to miss any part of the webinar, there's no problem. It will be posted on our YouTube page from tomorrow. It will also be on SoftFil Academy's website. The webinar will also be subtitled in French, Spanish, and German. So I think I gave you all of the information necessary. Now, I want to give you a little bit more feedback and information on Dr. Nina Bal and her path and her career, and why is she so perfect to speak about cannula injection. So could you please switch slide, Dr. Bal? So Dr. Nina Bal is a cosmetic dental surgeon. Her services include restorative cosmetic dentistry, facial aesthetic treatments and aesthetic medicine, non-surgical cosmetic procedures, and non-surgical facial rejuvenation treatments. She's a member of the General Dental Council and also a board member for Safe Face and the International Academy of Advanced Facial Aesthetics. You might recognize her from TV, as she's part of several UK TV shows such as Body Fixers on E4, This Morning Show with Holly and Phil on ITV, and also from BBC News. So Dr. Nina is the winner of highly commended Aesthetic Doctor of the Year 2022 at the Safety in Beauty Awards. She's also the Private Healthcare Awards 2021 at Best Aesthetic Facial Sculpting Specialist, and the 2020 Global Excellence Awards for the most outstanding facial sculpting treatment, among several others. So Dr. Nina is very passionate about enhancing a patient's innate beauty. Her philosophy is less is more, and she loves to make subtle aesthetic tweaks that lead to excellent yet natural results, which completely fit with our philosophy here at SoftFil and with all the results that cannulas and all of our products can achieve. So we are very excited to hear more about her presentation tonight and to hear about her approach to facial architecture using micro-cannulas. I will now give you the stand, Dr. Bal. You can start your presentation, and again, we will answer all the questions at the end of the webinar.
Thank you very much for the lovely introduction, and good evening, everyone. I hope you can see me, can hear me okay. I am thrilled to be here tonight and to be able to share what I've learned over the last 13 years of doing facial aesthetics and over 15 years as a dentist. So my talk tonight would be around my approach to facial architecture using the cannulas. So I am Italian. I'm full Italian, although I live in London at the moment, and I've been living in London for the last 12 years. So let's dive into it. So if you don't know me, my name is Dr. Nina Bal. So I am a cosmetic dental surgeon. So my background, very proudly, is in dentistry. However, I don't practice dentistry anymore. I stopped in 2020 with the pandemic, and I've been doing non-surgical facial aesthetics now for over 11 years. So I started quite a while ago when I first moved to UK. And that's my passion. That's what I love. And I think I truly believe that whatever you love doing, success just comes and you become better. So my heart wasn't in dentistry. It is in aesthetics very much so. but I'm so proud of being a dentist because as I'm going to show you during my presentation, that allows me to see aesthetic with a dentist cap. And that is really, really useful. And I'm going to show you why. So my clinic is in central London, in Belgravia, in the very heart of London. And that also comes with, very high expectations from clients, very high-end clients. And that's why SoftFil cannulas are ideal. And again, I'm going to explain why as well. So just to be super clear and super transparent, I'm a KOL for SoftFil cannulas for Revanesse, hyaluronic acid, selenium, and also for Lutronic. During my presentation, during the videos I'm going to show you, I'm going to be using some Revanesse product and also one thioxane. So the way I assess my patient's face during my aesthetic consultation has changed massively over the years. And I think now the way I do it now is obviously it's a combination of experience, knowledge of aesthetics, beauty, medicine, and dentistry. And really allows me to analyze my patients not only for the aging process and advise them regarding the most suitable treatment plan for anti-aging or targeting the signs of aging that bothers them, but equally also lots of patients come to me for facial structure. So they say a classic line they say to me is, actually, I'm not really sure why I don't like my face shape. There's something off. I can't really pinpoint. Can you help me? So normally my consultations for literally almost every one of my patients is dual, is around anti-aging, but equally face structure. How can I hide or correct aesthetically a skeletal or dental malocclusion? So first thing I do when I clinically assess my patients is to analyze the facial third, because that is straight have an idea where, if there is an imbalance, what it is. So I use personally a ruler in my practice. I used to use a very fancy caliper, which is, the patient love it. But you can get the same measures for the same purpose just with a normal ruler. So whatever's best for you. So I can analyze the three thirds. So I go firstly for the upper third, which goes from the hairline to the glabella. Second third, from the glabella, the subnasal point, and then from the base of the nose up to. Now, as you probably straight away can realize, the only third that we can actually play with is the lower third, but equally the one where the malocclusion show. So already by measuring, I realize whether the patient lacks of vertical dimension. And so very often when a patient has a deep bite, so the teeth close too much, then already in the lower third will be shorter. So already in my head, I can treatment plan and think, okay, maybe we need to increase the length on the lower third. Same thing I do for the side profile. So side profile balancing is one of the most popular treatments I do in my clinic. Again, I use a ruler, and what I do, I analyze my main focus is on the lower third. So I personally treat the mid and lower third with the cannulas. It was a personal decision. I don't treat the upper third. Again, the more I get experience, the more patients I see, the more complication I've seen on myself and on my colleagues, and the safer I become. And that's why, again, SoftFil cannulas are essential in my practice. So when I analyze the lower third in the side profile, again, already I start to have a clear idea of the kind of occlusion that the patient has dentally and skeletally. And so again, I start to treatment plan. So that's where my dentist cap comes on, and it gets really useful in my facial aesthetic treatment planning. So the ideal occlusion is called the class 1, which is the one in the center. So I'm not going to go into much detail about the dental occlusion because it doesn't really affect, us about aesthetics. However, most dental malocclusions, if not treated in a young age, can also, and then again, if not treated while we are growing up, then the skeletal malocclusion of the bone structure and the soft on top of them becomes more and more apparent. And with the aging process, there's no, so if there's any sort of malocclusion, which when you're young you can get away with it and not being very obvious, by losing elasticity with the aging process and losing volume, everything shows. If there's a crossbite, which means if your midline is not centered and your chin goes on one side and the teeth goes on one side as well, again, you might not notice much when you're young. When you get older, you have asymmetrical jowls. So again, first thing I do is always look into the mouth. With the class 1 occlusion, essentially what I'm looking for is the line between the lips and the chin. So I don't really look into the mouth in that case, but just with my ruler again, I place my ruler and I say, okay, this is a class 1. So I know already that if someone, let's say, comes requesting a chin filler, let's say, however, there are a class 1 on the side and the 3/3 are the same length, I'm saying, I'm sorry, I'm not going to do it because I know it will give them a too much elongated chin, a pointy chin. So always refer back to the malocclusion. The class 2 is the most common malocclusion. It's the most also treatable, which is good. So essentially what's happening in a class 2, the axilla, the bone of the aptive is over projecting. So the patients present a side profile with a retrognatic mandible and over project maxilla. So as you can very clearly see from, if I draw a line like this with my mouse with the arrow, you can see that the profile is convex. So there's often this patient have an over projecting dorsal hump in the nose and a very weak chin, over projecting upper lip. Again, so as you can intuitively treatment plan them just from this picture, these kind of patient needs a projection of the lower lip and projection of the chin. Typical case where if someone is a class 2 and comes to me and requests an upper lip filler only, or they say, I really want to have a much bigger upper lip, I'm like, I'm sorry, I'm not going to give this to you because it's going to make your side profile, your class 2, much more obvious. And so what I do, I often, depends on the severity, either don't touch the upper lip or do just lower lip and just a projection on the chin. Sometimes they need a combination of nose reshaping and chin as well, but the issue is not the nose per se, it's just the position of the chin. The class 3 is the opposite, is a prognatic mandible, overdeveloped mandible, and a retrognatic maxilla. So the side profile in this case is concave. So again, just from seeing this photo here, what do we need to do? We need to create projection in the upper lip. So obviously we can't shave off the bottom lip, we can't shave the chin. However, we can increase the projection of the upper lip, and that just doing that subtle tweak with my 25 gauge cannula, you balance the side profile. So although we can't correct it, we can really effectively hide them. My choice are the SoftFil cannula. There's many reasons why I love them. So there's 2 kind of them. So there's the Easy Guide, which are the ones I'm going to talk about in a second, and the Precision as well. So I use both. The Easy Guide are very easy. I wish you guys gave me those when I started my journey 12 years ago. My life would have been so much easier. So essentially, the reason why they're called Easy Guide is because there's these kind of butterfly which contains pre-hole needles and a guide for the cannula. So essentially, you just do the entry point using this tiny butterfly, you leave it there, and then I'm going to show you in the video, the cannula super easily slides here. So you don't need to look for the hole. Everything is made for you. So absolutely ideal if you're not very experienced in aesthetics, if you're starting. Equally super useful if you've been doing aesthetic for a while. So then it comes in different sizes. The precisions are the other type, which I use a lot as well. Now, what I love about SoftFil is that there's so many different sizes to choose from. I'll tell you my choice. My favorite ones are the 22 gauge, 50 or 70 millimeters for the jawline, or the 23 gauge, 50 millimeters, or the 25 gauge, 50 millimeters as well. Personally, I don't use anything bigger than 25 because for me the cannulas, it's all about safety. So if you go as small as 27 or 30 gauge, it's almost like having a needle, so you can really perforate a blood vessel. And so I feel much safer, and I'm going to tell you exactly which areas I use what. Also, what I love about SoftFil is that there's this red dot here, which shows me exactly where the flow of the product comes out. So if I want to place my product deep, I'm just going to turn the cannula, turn the dot underneath. So I know it's going to be placed on the deeper level or vice versa. And the beauty of the cannula is the fact that you've got a round tip. So with SoftFil, I know I'm going to be very safe for my patients, and it gives me the peace of mind, which is completely priceless, to know that I do everything possible to minimize risk of embolization and vascular occlusion. As I was saying, when I first started my journey in aesthetics over 10 years ago, I can't even think what I was doing. I was using needle and glabellas. I was doing crazy things. And now the more experience I get, the more I really, for me, it's about safety. And I had 2 cases of vascular occlusions in my career. One was in the nose, one was in the lips. I stopped providing no surgical rhinoplasty for that reason. I'll leave it to the very trusted colleagues that they can do it really well, surgeons. However, I learned my lesson in the lips, and nowadays I only use 25 gauge cannula, SoftFil, 50 millimeters in the lips, and I'm gonna show you. Just gonna drink. Sorry guys, I'm just having a bit of a cough. So, where do I use cannulas? So, whenever I have to replace volume loss, work with facial architecture of my patients, my areas of choice of cannulas are the T-trough and the mid-face, the nasolabial folds, the marionette lines, line, and the chin. In the cheeks, I'm still old style. So when I learn, I used to do cheeks with the needle, and I still do because I feel very. Sometimes I use a cannula as well, but mainly my non-negotiable areas where I only use cannulas are the one I just mentioned. So my 25 gauge is ideal for tear-trough and lips. Again, you can use either the Easy Guide or the Precision. Again, because I learned the old way, I mainly use my Precision. And 25 gauge, 50 millimeters is the one I love. Now, whenever I do tear-trough or mid-face, so by the way, I am moving away from tear-trough more and more, because the more studies I see, the more patients I see of complication of tear-trough filler having had it done years ago, the more I kind of reassess my patient carefully, and there's any sign of fat herniations, issues, lymph drainage issue, I stay away. However, I still use it massively to create support in the mid-face, and that's I'll show you my model when I did exactly that. So regarding your mid-face, what I do, the entry needle on the periosteum, and then I slide my can deep underneath the auricularis oculi muscle. I'm gonna be deep. At the beginning of my career, when I was scared, I was going too superficial, and I had many cases of Tyndall effect, which is the effect where the under eyes look kind of bluish. We can see the products on this, and also can affect more the lymphatic drainage on that area where really the old system is very, very delicate. So very, very easy to impact the drainage. On the lips, I still use exactly the same cannula. However, say very superficial. I want to be above all the blood vessel, above the artery. I don't want to have any issues in terms of vascular occlusion. So it's a very different tissue plane. And I use in both cases a retrograde linear technique. My 22 or 23, 23 or 20, 22 or 23 gauge cannula is the biggest one I use. And in my hands is ideal for the folds, net lines, and jawline. So again, I stopped doing nasolabial and marionette lines with needles. I want to sleep well at night, and using my SoftFil of that size guarantees me the maximum safety. So I do the entry point away from any dangerous area, and I slide my cannula subdermal in both areas, and normally get a beautiful result with much less bruising as well. So for me, it's a win-win. I am much safer. I can breathe, I can sleep at night. I know I minimize the risk of vascular occlusion and potential necrosis. And the patients love it because they know it's minimal bruising, minimal discomfort. And you see my patients in the video, they're extremely, extremely comfortable. The lips, as I was mentioned, I actually had 2 cases of occlusion, which are resolved straight away with a needle. I moved completely only to cannula for the last couple of years. So the way I do it, I basically do the entry point on the edge of the lateral side of the vermilion border. I do 2 entry points. I went through a phase where I tried to do only one, just around here. However, I couldn't be as precise. I had to bend the cannula. I wasn't happy. So I went back to what I was doing before, which is doing 2 entry points. So I do one for the upper lip and one for the lower lip. So 2 per side, so 4 in total. The entry point is hidden in the vermilion border. The patient loves it because it doesn't see it, closes very quickly, it's very safe. And then the position of my 25 gauge cannula depends entirely on what kind of result my patient wants. If my patient wants just a bit of definition of the lips without much volume, then I'm not going to slide it very close to the vermilion border. If my patient wants proper plump, bigger lips, definitely volume, then I'm going to go more towards the wet mucosa. So the more you inject, always with a linear thread, my product towards the wet mucosa, the more projection and the more lip volume they're going to achieve. Most cases, it's something in between. Again, you're not going to go too close to wet mucosa for migration. Similarly for the vermilion border, most cases, it will be something in between. Sometimes when I do the philtrum or raise the cupid bows, that's when I use either a needle, but I sweat, so I like to be safe, and I use, again, the cannula, do a tiny entry point, and I just slide the cannula just for the first third of the philtrum, not all the way, just for the first, just to give you that tiny lift of the cupid bow that works really beautifully. So I've got 2 case studies to show you. One is a male model, and I did a mid-face volumization and then a jawline definition, and then the other case will be a female model where I did the lips. So this is my first video. So this is my male model. So I'm marking him up. I'm doing a mid-face rejuvenation and a jawline definition. So when I mark for the mid-face, I trace 2 lines. One goes from the lateral canthus to the oral commissure, and from the area of the nose to the tragus. And I use, in this case, for the mid face, a SoftFil Precision 25 gauge. So I'm going to show you fast how I did the mid face. So in this case, I didn't use the easy guide, just a normal precision. So at the intersecting of these two lines, pretty much in that area, I just go with the needle. So I go deep, I aim for the periosteum, and I know in that area I'm away from the infraorbital nerve, from the infraorbital artery. I'm in a safe area. Obviously, something else I also always say to my students, be careful when you inject, just clean the pencil, don't go through your through the actual pencil. So I did the whole with the 25 gauge, and then I slide my cannula. So you can see here a bit more clearly. So I slide my cannula really gently, and I'm going deep. I'm always aim to go deep. So I want to be below the muscle. I'm going to go really gently. So it's all about playing like an instrument. You don't want to push. If I feel resistance, I take my time. I really take my time. I want to be gentle. It's all about finding the way really carefully, and it takes how long it takes. So, and then I always place my finger on the orbit. I'm going to protect the ligament. I'm going to protect the product not to go into the eye globe. There's too many studies I've seen of product going migration to the eye globe. So I want to say again, very safe. I protect the ligament, and I just thread the cannula. When I inside my needle, you can see me doing this kind of movement. I'm Italian, and I say I always stir my coffee. So that's my movement of stirring a coffee, just to make sure the hole is big enough. So it's worth spending a couple of extra seconds with the needle to do that, instead of like really struggling to get the cannula in. You feel more relaxed, therefore the patient is more relaxed, because there's nothing worse than just not finding the hole and just having to push the cannula. So stir your coffee a little bit longer, and then the cannula will slide in beautifully. So I love my 25 gauge SoftFil Precision, because it's the ideal combination of being being flexible, but also being very rigid. So you get that support, but equally it's never a struggle, can just slide really nicely. And the 50 millimeters has really the perfect length to go through to cover the whole area. So years ago, I used to do 2 entry points to cover the whole area, to do the tear trough. So I was doing an extra entry point more higher up. However, now I just do only one. I try to reduce the entry point for my patient's comfort, and also for the aftercare. As I was mentioning, my patients are quite high profile. They don't want to be bruised, and with that entry point, with the SoftFil cannula, I can really cover the area beautifully. So I can really go anything from the actual tear trough all the way to the mesopart of the cheeks, and building the area really nicely. So to be safe, I use the entry point in a safe area. I use a very linear injection technique, retrograde, and I move my cannula all the time. I move it, and then if you see what I'm doing, at the end of it, I'm basically I move the cannula 90 degrees before I exit. So that gives an extra, you can see clearly here, it just gives a really nice OG curve of the cheeks. It just lifts, also then the labia folds beautifully in a very, very nice and natural way. Then I moved here now on the jaw. I'm using Easy Guide 23 gauge, 70 millimeters on this side, and I'm gonna use on the other side 22 gauge, 50. So this is the Easy Guide. So it's can you see how easy it is to find the hole? There's no looking for it there. So you can just slide it super easily. It's like butter. It just makes life so much easier. So in the jaw opposite then to the mid face, I'm very superficial. I want to stay above the artificial artery, above the blood vessel. I want to stay, excuse me, very superficial as much as I can. So again, what I do, either if you struggle, I either try to stretch the skin, you create a path. So it's a balance of stretching the skin to create the path for your cannula, and equally hold the jawline where the patient has been marked, to make sure you create a really nice linear retrograde thread that gives a sharp definition and contouring of the side profile. So in this case, I'm using some Revanesse shape, which works beautifully. Again, so that my entry point is normally at the angle. So I draw the angle of the mandible. I just literally, to mark the area, I palpate the patient angle, the patient mandible, and I follow it. I don't really follow specific angle. I just follow what I feel on my patient to give the most natural result. So I slide it through. I like to hold, stretch to find my path, and then hold it. And then once I found it and I inject really slowly, then I always massage it. So as you can see, the patient is extremely comfortable, and you barely see it, just the treatment, and there's no marking. On this side, I'm using a precision 22 gauge, 50 millimeters. In the jaw, my preference actually is 70, because you can really use it all along the jawline. So 50 is okay, but 50 is ideal in the mid face. In the jaw, 70 is actually perfect. And in this case, there's no, however, hold the needle, the cannula slides super easily. So again, same technique. I want to be superficial. I want to make sure my cannula slides easily. Always find the easy, and if you can't find it, don't push too hard. Just find another way. Just keep finding it. It's much safer, much more comfortable for the patient. The patient love it. They feel nothing. It's actually, my cannula, there you go, has gone through nicely. So when the patients experience the SoftFil cannulas, it's really helpful for retaining that patient, because the patients are extremely comfortable. They love it. There's no bruising, barely any, very minimal swelling. So it's a very atraumatic injection. Again, I just like to hold the tissues when I inject, making sure I really grab the soft tissues above the lower margin of the mandible, so I know I'm in the right place, and I just help to define the area really nicely. Often what I do, I just lift the cannula, making sure wherever I am, making sure I'm on the right tissue plane. So on the mid face, when I lift it, I don't want to see the cannula, making sure I'm deep. Here, I want to see it, so I know I'm superficial. And then the same entry point. I don't do this all the time, but sometimes I just go through the vertical branch of the mandible. So same entry point, and then I just slide my cannula, always very superficial, just alongside the vertical branch, just to create a really nice definition, nice angle. Again, just depends on patient's assessment, so I don't do that all the time. So the treatment has just been finished, and then that's the massage. So I use Redensity from Teoxane in the mid face, and Revanesse shape for the jawline. If you do it properly with the SoftFil cannulas, the way the product gets placed very evenly, so there's no a huge amount of massage that is required. I just want to make sure the product is nice and smooth, and so I normally massage the patients for a couple of minutes after injection. The redness that is, you can see on him, is just a numbing cream. It's topical lidocaine, so nothing to do with the with the actual treatment. It's just an effect of the lidocaine. On the jaw, when I massage it, I always follow, I massage it quite firmly. I'm quite known to be quite firm, and that's the before and after photos. I can see nice jawline definition and nice orgy curve on the mid face as well. So the patient was really, really pleased. And again, super natural. You can just tell that on the after photos, the jawline is more defined, and then, but really nicely, was delighted. And then again, on the mid face, the redness, as I said, just the topical numbing cream. This photo has been taken straight after, so there's no marking of the cannulas at all. That's my other case study. This is a female model, and she's having a lips done. She's South America, so beautiful, naturally full lips. However, she is, said to me that they get really dry. So her main objective outcome was mainly hydration. She didn't want to have much volume, so we didn't do much. We did a 0.5 ml of Revanesse Ultra Plus using a SoftFil Precision 25 gauge 50 millimeters. So you can see I'm sliding my cannula very superficially. I'm somewhere in between the vermilion border and the wet mucosa. So yeah, in the middle of there, just checking I'm in the right tissue plane. I want to see the cannula when I do my lips. I want to see the tip. I want to make sure I'm superficial enough. And then I hold the lip, and very gently with the linear retrograde technique, I inject my product very slowly. Again, it's very, very comfortable treatment to do. The patient is extremely comfortable. She was very, very scared. You can see she's not, she only had some topical numbing. So I don't inject any lidocaine, even if I'm a dentist, purposely, because by injecting some lidocaine, I find sometimes that can change the lip shape. Some topical numbing cream works beautifully. And again, just by using the SoftFil cannulas, you don't really feel much. So it's very, very smooth treatment. So same, I'm doing now the lower injection point. The lower, yeah, I just serve my coffee again. Do the lower entry point. Yeah, I just find in my hands, I find doing one entry point, it's just not worth it because you can't be precise enough. Like this, you can see, you can barely see anything. That entry point heals so quickly and is hidden in the vermilion border, so it works really, really nicely. Again, slide my 25 gauge cannula. I normally stop just before the center of the lip, so I create, sometimes I do like 0.02 of product to create a bit of a nice heart shape in the bottom lip, and then I slide it really, 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 really slowly. So for me, the cannula in the lip has been a game changer. It's much safer, there's much less bruising, much less swelling, the treatment is more comfortable. The patients are very, very happy. They all come back and request you have a cannula. So same thing, I'm sliding. You can see how it's so smooth the way it goes. So unless the patient has had multiple dermal injection in the lips, so there's a lot of scar tissues, it just goes really, really smoothly. So most of the time it's like butter. You can, as long as you're in the right tissue plane. Some people say, oh, can you be precise with the cannula? Yes, I totally can. Again, just choose exactly which kind of plane, which floor you're going to be. If you want to be just definition, you just go the floor close to the vermilion border. If you want to give volume, just go close to the right mucosa. If not, just go somewhere in between. But if you do that, I am very precise with my cannula. I don't miss the needle at all. It's a win-win. And look, the patient is extremely comfortable. I love to massage, as you can tell. As soon as I inject, I just want to make sure everything gets as smooth as possible straight away. Now I'm doing the entry point for the lower lip. Again, I'll spend a little bit more extra second to get it right, so then the cannula can slide in super easily, look, straight away. Also, what I say to my patient I found really helps, when I insert the cannula, I say there's no needles anymore, everything is blunt. So they relax and you can really do your treatment, you know, with a very collaborative and calm patient, which is, we know, is half of the battle. So that it really helps as well. So yeah, it's all done. Literally, I do my lips within minutes. Is very, very quick. As long as they are, you know, numbed, I put topical numbing cream for about 15 minutes. And then the actual treatment with the cannula with the 2 entry points per side takes a minute. And also when I massage, what I do, I always check the capillary refill. So again, after I had the scare of the vascular occlusion, as I massage, I make sure the capillary refill is below 3 seconds, and that's a before and after. Super subtle. Patient was delighted. So as you can tell, like I injected somewhere between the border and the mucosa, and I did, as I said, 0.5 ml of Revanesse Ultra Plus, and you can see that the apex of the cupid bow is slightly lifted. I did inject in the philtrum in this case. I didn't have to. She had a really nice projection, and the patient was delighted. And this is taken seconds after the cannula was removed from her lips, and there's no marking, as you can see. There's no marking, so the patient is the patients love it. So just to conclude my presentation, so for me, the cannulas, the SoftFil cannulas, are a godsend. They maximize my safety. They reduce the vascular compromise. They reduce my risk of vascular occlusion massively. And the entry point, which I'm fully in control where to do it, I choose to do it away from the danger zone. Minimizes the pain. It's a very painless procedure. Everything is blunt. The cannula is blunt, is rounded tip. So there's very, very sensitive patient. There's a little bit of pressure and that's it. And the minimizes the bruising. That's a massive selling point for my patients, my high hand patients. No one can afford to have a massive bruise on their faces for weeks in central London, but nowhere, I think. The single entry point reduces the risk massively. And again, if you are, I always choose my entry points away from danger zone, but even if I do it and I can see instant bleeding, I just change the entry point. There's no point for me sweating or suffering or thinking, gosh, what did I hit? I just change it. I want full peace of mind. So I don't actually, I used to aspirate on my entry point. So I used to attach a syringe on the needle, aspirate for a few seconds. There's different opinions on it. I found it wasn't a complete reliable technique, and so I don't aspirate anymore on purpose. And I just do my entry point, and this any bleed, I just change position. So also the cannula allows me to accelerate the recovery time. There's minimal bruising, minimal swelling. The patients love it. It's a really lunchtime treatment. They come and have a full face done in lunchtime, and I put some oxygenetics on top. They can have that straight away, and they are ready to go back to the office. And amazing for beginners. Like, as I said, if you're not very experienced, the SoftFil Easy Guide are ideal. Build your experience and just your hand. So I hope that was helpful, and please feel free to contact me. That's my Instagram handle, that's my website, so you can email me, you can DM me, whatever is most comfortable. And so I look forward to connect with you, and I'm open to any questions.
Thank you so much for this really amazing presentation, Dr. Bal. I think everyone really loved it. Your videos were such great quality, and you have really a very interesting technique. So thank you so much. We do have some questions for you. I'll start with the first question here from a doctor from Mexico. Who was asking about the best cannula for biostimulation in temporal area and the middle third.
Okay, so biosimulation. I don't know, it's an area that I inject, so I don't think I'm the right person. However, for the lower third, I would say 25 gauge. 25 gauge, again, I would just stay away from definitely from 27 or 30s in the temporal area because then we know it could be an area which potentially could be dangerous. So you don't want to mimic a needle. So I would say 25 or below. But as I said, because I don't do it, I don't want to advise. For the lower third, I would go for 25 gauge. It's because it's maybe potentially the 22 it could be slightly too big because you need to use quite a viscous product for a 22 gauge. I fear a biosimulation, so a skin booster may be too loose and you might inject too much. So 25, I would say, will be the best one.
All right, thank you. A question, I think that was about the first patient, the first video that you showed. They were asking if the patient was anesthetized during the treatment. Yes, that was the question about anesthesia.
Yeah,
Oh,
you're back now.
Bal, can you hear me? I think
Yes.
everything froze. Sorry.
Yes, you're back now. I can see you, I can hear you now.
Oh, yeah, okay, great. So it was about whether your first patient was anesthetized during his treatments?
So again, he only had some topical LMX4 we have in UK, which is lidocaine 4%, just topical, nothing else.
All right, great. Another question from a doctor from Macedonia, who is thanking you for this really great webinar. And he wanted you to go over again about the jawline treatment that you did, describing your cannula and the filler that you used in that area. If you can talk about it a bit more. I think he missed that part, so he wanted a small reminder.
Yeah, absolutely, with pleasure. So in the jawline, I use either a SoftFil Easy Guide 23 gauge 70 millimeters or a SoftFil Precision 22 gauge 50 or 70 millimeters. Now, I never use anything smaller, so I don't use 25. In the jawline, 22 is perfect because the product we use in the jawline are quite viscous, or quite thick. I personally use Revanesse Shape. It really gives a really nice projection. So what I do, I mark my patient. I palpate the mandible. I really draw the angle of the mandible of the patient. I do normally 2 lines. And then the entry point is always behind my line. It's never in the pencil, is behind. So I do the entry point, then I slide the 22 or 23 gauge cannula very superficially. In the jawline, you want to be superficial. I slide really, really gently as long as reaching is a retrograde linear technique all the way along. If I struggle to go in, stretch the skin, the more you stretch, the more the cannula finds a way gently. Don't push it. If it doesn't go, find somewhere else, change entry point. And then by inject, I want to pinch. I want to hold the tissues above the inferior mandible or the mandible, and I inject retrograde. Sometimes, not all the time, I also do the vertical branch of the mandible. Same entry point, you just go in and then you rotate the cannula vertically, very superficially as well, just a linear thread, just to define that if it needs any support.
Okay, thank you. Which fillers have you been using during the webinar? Can you kind of give an overview of the fillers that you used?
Yeah, absolutely. So on the male model, for the mid face and tear off, I used and I would use normally in my practice the Teoxane Teosyore Redensity 2 or the Sinclair Miley Precise. That's lovely as well. For the jawline on the male, I use the Revanesse Shape. And then on the female model for the lips, I use the Revanesse Ultra Plus. Sometimes I use also the Kiss for the Revanesse if there's someone that it doesn't want any volume at all, or sometimes I use the Revanesse Outline if it's a more I would say older lady, which needs more structure, more definition of the lips.
All right. Well, I think we're done for today. We have no more questions. Everything was so clear and detailed. Thank you again for this amazing presentation. And to everyone, there were a lot of questions on whether it was recorded or not. Yes, the webinar was recorded. You can see it from tomorrow on SoftFil Academy's website or on SoftFil's YouTube page. It will also be subtitled in French, Spanish, and German. So thank you again, Dr. Bal. It was really, really interesting. So many people said that they really liked it. And have a great evening.
Okay. To contact me. I'm Italian, so if it's anyone speaks Spanish or Italian, I can answer in that language as well. And yeah, thank you so much again. It's been a pleasure.
Amazing. Thank you so much.
No
Bye.
problem. Bye.